A sharp burning in your chest after eating something spicy. That heavy, swollen feeling in your stomach after a large dinner. We have all experienced these physical reactions. Most of us brush these moments off. We grab a quick, over-the-counter antacid, wait for the discomfort to fade, and move on with our day without a second thought. But sometimes, early-stage stomach cancer uses these exact same everyday annoyances as a disguise. It is a biological reality known as medical mimicry. A developing tumor often produces incredibly vague early symptoms: mild acidity, feeling full too quickly, or general indigestion. To the person experiencing them, a severe disease feels practically indistinguishable from a standard food hangover. When a life-threatening disease and a standard stomachache share the same symptoms, doctors must look for specific deviations to tell them apart. Treating all stomach pain as harmless carries significant risk. Survival depends on identifying the threshold where routine discomfort becomes a specific warning sign. This diagram outlines the upper digestive tract. Acidity is a mechanical issue. When stomach acid moves upward, it creates a burning sensation. Bloating is a pressure issue. Trapped gas causes a volumetric expansion inside the stomach cavity, leading to tightness and swelling. The defining trait of these benign issues is that they are temporary. They naturally improve over time or disappear once you adjust your diet or take basic medication. As long as the symptoms resolve, they are typically physiological noise, a reaction to external inputs rather than a sign of an underlying structural failure. The mimic drops its disguise when the symptoms refuse to improve. When dietary changes and medications stop working, you have crossed a clinical threshold. At this stage, doctors look for specific red flag markers that indicate the presence of a systemic disease rather than simple indigestion. Certain physical signs require immediate intervention. These include unexplained weight loss, black stools, and vomiting blood. Other systemic markers include severe difficulty swallowing, persistent anemia, and extreme fatigue. There is also a distinct behavioral indicator: digestive symptoms that are intense enough to wake you from a deep sleep. The appearance of these red flags transforms a common stomachache into an urgent medical situation that requires investigation. Once those alarms trigger, doctors can no longer rely on external symptoms. They must visually examine the internal environment. To get past these surface-level symptoms, doctors often rely on an endoscopy. During an endoscopy, a specialized flexible camera is guided down the food pipe and into the stomach, providing a real-time view of the lining. This allows the medical team to find visual evidence that distinguishes a harmless ulcer or inflammation from a malignant growth. Direct visualization provides the hard medical evidence needed to identify the exact cause of the distress, removing the need for guesswork. Statistically, the vast majority of acidity and bloating cases are benign. Most people experiencing these symptoms do not have cancer. Online self-diagnosis often leads to unnecessary panic because it lacks the clarity to differentiate between symptoms. The definitive rule is to seek a professional medical evaluation if symptoms are frequent, progressive, or accompanied by any of the established red flags. The body's digestive distress serves as an early warning system, offering a head start on detection before a disease can advance. Identifying these subtle signals early allows for medical intervention while a condition is still manageable, which significantly improves the likelihood of a successful recovery.